Those are, in fact, just some of the challenges ahead for health care reform. There are many steps to make, but the first may have been yesterday's health care forum at the White House, a summit, if you will. Let's go ahead and talk to a couple of people who are actually in the room. Joining us from Washington this morning is Jane Delgado from the National Alliance for Hispanic Health, and Marian Wright-Edelman, the president of the Children's Defense Fund. Marian, we want to go ahead and begin with you. Obviously, you are very interested in the welfare of children in this country. What was your takeaway from the summit?
Well, I was very encouraged by the summit. I applaud the president for bringing all the key stakeholders together to restate his sense of urgency about health care reform for all Americans now, including our 9 million uninsured children. He's promised a children's health mandate, and we look forward to working with him to achieve that. I really applaud his sense of urgency, in the sense that he knows we cannot get economic equilibrium without having health care reform and controlling health care costs. And it was a very open, transparent debate, and I think a major step forward. Now the hard work begins to ensure choice, including the choice of a public health insurance program.
Well, specifically what was talked about regarding children, and as you mentioned, the 9 million uninsured.
Well, you know, he mentioned the fact that they had passed the CHIP bill, the Children's Health Insurance bill, but I think it was just a down payment on what we have to do to finish the job. He's promised a child health care mandate. The CHIP bill covered only 4 million of the 9 million uninsured children, a number which is probably much greater now because of economic downturn and the loss of parental jobs and health insurance. And we want to make sure that the kind of structural reforms that are necessary to ensure that children have actual access and comprehensive benefit packages will be forthcoming. CHIP was not child health reform. It was not a child health mandate, but I applaud and thank him and the Congress for moving forward, but we have much more to do to get all of our children and all of our pregnant women. And while there was much discussion correctly about the importance of prevention, children are prevention, and the best way we can begin to get a hold of escalating health care costs is to see that we're getting our children immunized and seeing that they're getting good primary care.
And clearly, you said it yourself, the issue becomes cost, as always. You feel good about how all of this will be funded.
Well, cost is about reform, because one of the key things is people who are saying he's trying to take on too much, but we can't control the kind of soaring problems in our economy and the inequities in our healthcare system and in our economy without dealing with healthcare costs. And so it is crucial to beginning to get some sense of recovery in our economic health, to have health care recovery and health care change.
All right, so clearly you took away a lot and you are feeling very, very good. Marian Wright-Edelman, sure to appreciate this. And we want to get over to Jane Delgado now and ask sort of the same questions, if you will. Jane, obviously, you are very interested in the health of Latinos in this country, but according to your organization, 1 in every 3 Latinos do not have insurance. What was your takeaway from the summit?
Well, the summit was a very bold step from the president, and I think the most important thing is that he said both short-term and long-term, we have to look at what the solution will be. Short-term, there will be more increased costs, because in the United States, we need to cover all those people who are not covered, and we also have to have better insurance for those people who are underinsured. He was very clear that access is only part of the problem. What happens once you get into the system? How is that going to really affect each and every patient? You know, it was wonderful to hear him say whatever solution we have will be clearly an American solution. We are not like other countries where single payers, you know, would be the kind of decision we want, or do we want just a free market? We want something which is a combination which really answers to us as Americans. And for Hispanics, remember, the reason we have the highest rates of uninsurance is because our community work, but they work in jobs where they either do not earn enough money to pay for the premiums, or their employer does not offer it. So insurance for us is very important, especially for the laboring, working communities throughout this country.
I have to ask you the same question. The cost, as you mentioned off the top, it comes back to that. Are you comfortable with the amount of money that is being put into this? And how long are you willing to wait to see some of these results?
Well, we've been waiting for years, for decades. You know, when this country passed Medicare in the 60s, the idea that we were going to take care of our older adults and give them wonderful care. And compared to any other country in this world, we do that. For people over 65, we provide them a lot more access and care than other countries do, especially those countries where they have centralized decision-making about care. So I think that we have to look at the cost question in two ways. First of all, health is an economic driver. There are jobs, there are opportunities, there are lots of things that we can do to rethink what is the discussion in the United States we need to have about providing care to our people. And that discussion we've never really had. We're starting it. I think the president has been very enthusiastic and very strong in trying to get bipartisan conversations going. This is a good beginning, and of course the details are to come, but we're right here working with them.
Yeah, and the other questions too, I mean, they're boundless really, but you know, how comfortable are people who can afford health insurance with paying for those who can't, and then just maybe the overall price of insurance in general. Any insurance folks in there?
Yeah, but part of the issue is once you insure everyone, the cost will come down, because right now a lot of insurance is based on risk. So the concept of making sure everybody's covered will sort of spread the risk around and change the way that we do it now. And we have to change the way we do it now. And covered for what is the other question too. Unfortunately, as usual, we could talk about it forever. Jane Delgado, we sure do appreciate your time today. Again, Jane is with the National Alliance for Hispanic Health, and Marian Wright Edelman, president of the Children's Defense Fund. Thank you, ladies, very much.